In this podcast episode, Peter Aya welcomes Dr. Paul Turek, a renowned expert in male fertility. The discussion delves into various aspects of male reproductive health, including the impact of testosterone replacement therapy, TRT, the intricacies of sperm production, and the factors influencing male fertility. Dr. Turek begins by emphasizing the critical role sperm play in conception. He notes that sperm are not just a means to an end. They are the very foundation of male fertility. The evolutionary pressure to ensure successful reproduction has led to a highly sophisticated process of sperm production and maturation. Understanding this process is essential for addressing infertility issues. Dr. Turek highlights that the journey of sperm from ejaculation to fertilization is fraught with challenges, and only a minuscule percentage of sperm actually reach the egg. The discussion also touches on the various factors that can affect sperm quality and quantity. Dr. Turek points out that lifestyle choices, environmental factors, and even stress can significantly impact sperm health. He notes that many men may not realize the importance of sperm quality until they face fertility challenges. This underscores the need for men to be proactive about their reproductive health, as sperm quality can be a reflection of overall health. The conversation shifts to testosterone replacement therapy, a common treatment for men experiencing low testosterone levels. Dr. Turek explains that while TRT can be beneficial for improving energy levels, mood, and libido, it often comes with the downside of suppressing natural sperm production. When men take exogenous testosterone, their bodies may stop producing testosterone naturally, leading to a decrease in sperm count and fertility. Dr. Turek elaborates on the mechanisms behind this suppression. He explains that testosterone replacement therapy sends signals to the brain that reduce the production of luteinizing hormone, LH, and follicle-stimulating hormone, FSH, both of which are crucial for stimulating sperm production in the testes. As a result, men on TRT may find themselves facing infertility issues, which can be particularly distressing for those who wish to start a family. Dr. Turek emphasizes the importance of lifestyle factors in male fertility. He discusses how obesity, smoking, and excessive alcohol consumption can negatively impact sperm health. For instance, he notes that obesity is linked to hormonal imbalances that can lead to lower testosterone levels and reduced sperm production. Additionally, smoking and heavy drinking can introduce toxins into the body that harm sperm quality. The discussion also highlights the significance of diet and exercise in optimizing reproductive health. Dr. Turek encourages men to adopt a balanced diet rich in nutrients that support hormone production and overall health. Regular physical activity is also crucial, as it can help maintain a healthy weight and improve hormonal balance. By making these lifestyle changes, men can enhance their fertility and overall well-being. Infertility is a complex issue that affects many couples, and Dr. Turek provides valuable insights into the male perspective. He explains that male infertility is often overlooked, with many couples focusing primarily on female factors. However, male infertility accounts for a significant portion of fertility challenges. Dr. Turek emphasizes the need for comprehensive evaluations of both partners to identify potential issues. The conversation also addresses the emotional toll of infertility on men. Dr. Turek acknowledges that many men may feel a sense of shame or inadequacy when faced with fertility challenges. This emotional burden can further complicate the situation, making it essential for healthcare providers to approach the topic with sensitivity and understanding. By fostering open communication and support, couples can navigate the challenges of infertility together. Dr. Turek delves into the intricate process of sperm production, known as spermatogenesis. He explains that this process takes place in the testes and involves several stages, ultimately resulting in the formation of mature sperm. The entire process can take approximately 60 to 70 days, and it is influenced by various factors, including hormonal levels and environmental conditions. The discussion also highlights the challenges sperm face on their journey to fertilization. Dr. Turek notes that only a small fraction of sperm successfully navigate the female reproductive tract to reach the egg. This journey is fraught with obstacles, including the acidic environment of the vagina and the immune response of the female body. Understanding these challenges is crucial for addressing male fertility issues and developing effective treatments. The conversation shifts to the effects of heat on male fertility. Dr. Turek explains that the testes are located outside the body for a reason. They need to maintain a temperature that is slightly cooler than the rest of the body for optimal sperm production. Exposure to excessive heat, whether from hot baths, saunas, or tight clothing, can negatively impact sperm health. Dr. Turek shares findings from studies that demonstrate the detrimental effects of heat on sperm production. He notes that prolonged exposure to high temperatures can lead to decreased sperm count and motility. This information is particularly relevant for men who frequently use hot tubs or saunas, as these activities can raise the temperature of the testes and compromise fertility. Hormones play a crucial role in male fertility, and Dr. Turek discusses the importance of maintaining a healthy hormonal balance. He explains that testosterone, LH, and FSH are all interconnected in the regulation of sperm production. When one hormone is out of balance, it can have a cascading effect on the others, ultimately impacting fertility. The discussion also touches on the significance of estradiol, a form of estrogen, in male reproductive health. Dr. Turek explains that elevated levels of estradiol can suppress testosterone production, leading to fertility issues. This highlights the need for a comprehensive evaluation of hormonal levels in men experiencing fertility challenges, as addressing hormonal imbalances can be key to restoring fertility. Genetic factors can significantly influence male fertility, and Dr. Turek highlights the importance of understanding these factors. He discusses common genetic conditions such as Klinefelter syndrome and Y chromosome deletions that can lead to infertility. These conditions often result in low sperm counts or complete absence of sperm. Dr. Turek emphasizes the need for genetic testing in men with unexplained infertility. By identifying genetic factors that may be contributing to fertility issues, healthcare providers can develop targeted treatment plans. This approach can be particularly beneficial for couples seeking to conceive, as it allows for a more personalized and effective strategy. Sperm banking is a valuable option for men who may face fertility challenges in the future. Dr. Turek discusses the benefits of banking sperm, particularly for young men undergoing medical treatments that may affect their fertility, such as chemotherapy. By preserving sperm before treatment, men can ensure they have the option to father children later in life. The conversation also addresses the logistics of sperm banking, including the recommended number of samples to bank. Dr. Turek advises that men should aim to bank multiple samples to increase the chances of successful conception in the future. This proactive approach can provide peace of mind and preserve reproductive options for men facing potential fertility challenges. As the discussion comes to a close, Dr. Turek reflects on the future of male fertility research. He emphasizes the need for continued exploration of the factors influencing male reproductive health, including environmental exposures, lifestyle choices, and genetic factors. By advancing our understanding of these issues, researchers can develop more effective treatments and interventions for men facing fertility challenges. Dr. Turek also highlights the importance of raising awareness about male fertility issues. By encouraging open conversations and education around reproductive health, we can empower men to take charge of their fertility and make informed decisions about their health. This shift in perspective can ultimately lead to improved outcomes for couples seeking to conceive.